Why you need to stop stretching your hips when dealing with hip impingement. With this condition, you're going to feel pain and stiffness in your hip with activities such as squatting or lunging. And this is going to make you think that the muscles are tight, causing your problem. However, this condition is actually caused by bony changes to your ball and socket of your hip joint rather than tight muscles. Hi everyone, my name is Dr. Zach Greenwade here at Performance Sport and Spine in Seattle, Washington. In today's video, we'll be discussing all things hip impingement, from what causes it to how it presents, the best rehab protocol, and if and when you should have surgery. Now, this information is all evidence-based, so you can be highly informed on how to manage it yourself or have better questions to ask your healthcare providers that you're going to see. This condition affects the hip joint, which is a ball and socket joint. You have your ball of your femur or thigh bone and the socket of the pelvis or the acetabulum. Now there's two parts to this. So this part on the socket is called a cam. So when there's bony growth on this part, it's a cam. On the socket part, it's a pincer. Now it's important to note that you can have both, and some people will have these changes on x-ray and have no symptoms. There's also this cartilage thing called the labrum, and this getting pinched is actually what's causing your pain, and we'll talk about that more later in the video. Now these bony changes actually start in your teenage years, typically about 11 to 15 years old, because your bones are still growing and the growth plates are there. Now this is more common when people play sports because there's an increased demand and stress on the bone. So if your bone sits in your socket like this, and as you move around there's more stress, your body's naturally going to build more bone to handle that, causing these cam and pincers. But when we're young, we get away with it, so you have no symptoms. And these symptoms don't typically present until your 20s or 30s. Now we know what caused it. Let's talk about how it commonly presents and the things you should be looking for. And there's 6 main signs or symptoms you should be aware of. The first one is the classic C sign. So with your hand around the side of your hip where the pain is. One thing to note with hip impingement, about half the time both hips are going to be affected, and about half the time you'll have pain on the back side of your hip as well as the front. The second thing is you're going to have stiffness and tightness prior to pain. Remember, this is caused to bony changes, not tight muscles. So with a history, you should have pain second due to tightness and stiffness. The next one is because there's been those bony changes to the hip, your range of motion is going to be less. So before, your range of motion may be like this, and now it's going to be here. So the goal is to strengthen in that new range of motion, not try to create more range of motion. And your loss of range of motion will be most notable in flexion or internal rotation of the hip. Fourthly, you're probably going to have popping, snapping, or clicking associated with your hip pain. Again, things aren't moving quite optimally, and so tendons are going to pop or snap. Fifth, you're going to have a reduction in squat depth. Again, your range of motion has reduced, so you're not going to be able to squat as deep. Modify your training. And then lastly, prolonged sitting can irritate your hip, such as long drives or working at your desk. As we discussed earlier, your labrum was actually causing your pain with hip impingement. And because there's been bony changes, you're going to have less range of motion. This is why you need to stop aggressively stretching your hip. If you're trying to force that hip past where it wants to be, you can potentially irritate or further damage your labrum. So some light stretching is fine, but it's more within the range of motion you have. Don't challenge it hard at end range or you're going to pay the price, especially if you do it a lot for long periods of time. The best way to fix this condition is to strengthen all the muscles around the hip. The ones in the front, on the inside and outside, and the back. And this is going to help improve your function, reduce your pain, and improve your quality of life. Now with this condition, we're going to give you level 1 to level 5, starting with the easiest and then progressing to the hardest. There's no time between when you can progress, but progress as your pain and function allow. We're also going to give you some global exercises to complete this rehab. For your hip abductors, the muscles on the outside, we're going to start the level 1 band press out. So we're going to put the band on our feet and press both feet out, feeling tension on the outside of our hips. One thing to note with this is make sure that the affected side, the painful side, goes out as far as the non-painful side. Sometimes what happens is people will push out just a little bit on the painful side and a lot more on the non-painful. So really focus and make emphasis on the symptomatic side. Sideline lateral leg raise. So laying with your back against the wall and make sure to keep that heel against your wall so your leg doesn't go forward. We're going to raise our leg up, keeping the heel in contact with the wall, and then down. You should feel tension on this hip. And again, keep all 3 points of contact, your back, your butt, and your heel against the wall, slow and controlled. And again, your range of motion might be limited, so just raise as high as you can, pause, and then return to the starting position. Now we're going to put a band around our ankles in that same position with our butt and heel against the wall. We're going to raise our leg, feeling tension on the outside of the hip, and then return to the starting position. You can adjust the band stiffness to make it more challenging or more easy, but again, keep that heel against the wall and make sure you have good slow control and there's no jerking. Step up. Now you may need to adjust the bench to determine your current fitness level, but we're going to step up and drive with our hip up, pause, and then return to the starting position. Again, you want to lean forward a little bit to make sure you're getting the glute and not the thigh, but it should be slow and controlled. Make sure to fully straighten your knee and then return to the starting position. Now we're going to do the crossover step up. So with the outside leg, we're going to step across and then stand up. Don't step up with the inside leg. Again, at a 45-degree angle, we're going to cross, feel tension here, and then drive up. Some people's knee can be a little irritated, so you might want to hold on to a wall or a pole, but you want to feel it in your hip, not your quad, and it should be the outside leg. Hip flexors are the muscles in the front of the hip. In a seated position with our knees straight and the band around our midfoot, with some mild tension out, we're going to pull one leg up to tolerance, go down, and then repeat on the opposite side. Now, remember, our hip may have less range of motion in this, so only go as far as you feel comfortable. Once your symptoms start, stop there. We're not trying to increase range of motion, we're trying to strengthen within a range of motion. So now we're going to be on our back with our knees and hips at 90. Again, the band around with mild tension. Press one leg out as far as you can. Try to touch the floor. Return to the starting position and press the other leg out. Again, we want to only flex our hip as much as comfortable, so you have to adjust that to your current symptoms, but make sure there's not a pinching feeling. So you may even have to put one leg down, but you don't want to have a pinching feeling in the front of that hip. Heels elevated. With your knees straight and your heels up on a bench, raise up, and then pull one leg, return to the starting position. Feel tension on the front of your hip and only use the range of motion that you know you have. You should feel no pinching in the front of that hip. Hip flexion. With the band around your ankles, maybe against the wall for support, we're going to lift our leg up, feel tension in the front of the hip, pause, and return to the starting position. Now again, you may have some limited range of motion, so only go as far as there's no pinching, and it's better to increase the difficulty than try to increase the range of motion. We're trying to strengthen within the range of motion, not challenge. An alternate, if you don't have that PT band, is on the bench with your knees straight, lift one leg up, keeping your knees straight, pause, and then repeat on the opposite side. When you're doing that, feel tension in the front of the hip, and you want to minimize any bending to the side or forward. Now, if it's a little too challenging, what you can do is just bend your knees a little bit, and then repeat and use your arms as bracing. To increase the difficulty, you can do this in a seated position on the floor. Hip extensors, or the buttocks muscles. So laying face down with your knees straight, lift your leg up with the butt, not the back, pause for a sec, and then return to the starting position. Again, you should feel tension on your hamstrings and your glute region, not your back. Sometimes you need to lightly squeeze your core to make sure it's hip movement and not back movement. Level 2, put that band around your ankles in the same position with your knees straight. Press one leg up, pause, and return to the starting position. Again, make sure to feel tension in your glute and hamstring and not your back. Level 3 is going to be a glute bridge, so on your back with your knees bent. Using our hips, we're going to lift up, try to get full extension, and then return to the starting position. The emphasis should be on your hips and not your back. Sometimes flattening your back first and then lifting will help accomplish this. To increase the difficulty, put a weight on your stomach and then repeat the previous motion. So lift up with your hips, pause, return to the starting position. Make sure to get that full hip extension and emphasize your legs, not your back. So the last level is a single leg bridge. So bringing one leg up, press up with your hips and legs, full extension, and return to the starting position. Again, emphasize your legs, not your back. Adductor ball squeeze. With your knees bent, press your knees in towards the ball or pillow and hold for 20 to 30 seconds or to tolerance. Adductor squeeze, knees straight. Press both feet into the ball and hold to 20 to 30 seconds or to tolerance. Slider. With the band, pull your leg towards the other leg, feeling tension on the inside of the moving leg. Return to the starting position and repeat. Short lever Copenhagen plank. So in a side lying position with your leg elevated and your elbow under your shoulder, hold the tolerance in a level and neutral position. Not the long lever, so with your knees straight or extended, we're going to get in that side plank position with our elbow under our shoulder, keeping our spine and core neutral, and hold the tolerance. For the global exercises, we're going to start with a box squat. That helps us limit our depth so we don't go too deep. So with our feet about shoulder width apart and our weight on our midfoot, we're going to squat down using our hips, pause, and then return to the starting position. Again, you want to feel tension in your thighs and butt, not your back. When you're doing this, relax your back and just load your hips. Don't try to arch your back because then you start to do a good Morton. So just load your hips and come up. Now you may need to raise the height a little bit, and that's fine. To increase this, hold a light weight and do a goblet squat. Again, weight should be on your midfoot, load your hips, don't arch your back, and have good form. And then lastly is the Bulgarian split squat. So your rear foot's going to be elevated. So have your hand against the wall, place one foot back. And what we're going to want to do is squat down as low as we can and then come back up. A lot of people can have more depth on this and the squat, which is why I like it so much, but make sure our weight's on our midfoot and we're going straight down. We're not leaning forward. Go down as far as you can, pause, and then return to the starting position. You can add a weight to this to increase the difficulty. For the diagnosis, you need three things. It's more than just the bony changes. So first, you need clinical symptoms, and then positive orthopedic test, and then the imaging findings. So the clinical symptoms are the pain in the groin or hip, clicking, popping, snapping, reduced range of motion, generalized stiffness, and then some functional impairments. The two orthopedic tests are the Fader and Faber tests. Again, these have to reproduce your symptoms. And then lastly, you need positive findings on MRI and or X-ray. Earlier in the video, I said that 2/3 of the time this comes from people playing sports in their youth. Well, the following sports, you have a 2.5 times more likelihood of having this if you played them. Those being golf, rowing, soccer, basketball, football, and track and field. Now we're going to quickly review the timeline of this injury. So when you're young, teenage years, 11 to 15, and your growth plates are still growing, and the demands increase on your hips from sports or other activities, the changes to your bones happen. But you're young and you're a superhero, so you don't feel anything. Now fast forward a decade or two. You're in your 20s, maybe early 30s. Your hips are stiff and you're starting to get pain, popping, and limitations. Fast forward another decade or two. Now you might be getting hip OA and some labral changes, which becomes something different. If you are dealing with hip OA or hip arthritis, we have a video with over 1 million views that you can click on this link right here that can help address that and help you get you out of pain. Now we're going to talk about surgery and try to give you some important tips and facts to help you make a better informed decision whether you should or should not. So first off, surgery should never be the first option for almost anyone. You should have done 2 to 3 months of structured rehab like this video, not just light core, ultrasound, or stretching. And if that isn't successful, then do it. Another thing is a surgeon should never just say surgery is the only option for you. They should discuss the pros and cons and why maybe it is or isn't best for you and your current performance goals and rehab level. Some good facts to know about the surgery is about 50% will see improvement at 2 years. It may increase your long-term cartilage degeneration, and only about 20% of athletes return to pre-injury performance levels. There are some other structures that can cause hip and groin pain that we're going to briefly cover now. If you want a much more in-depth overview and exercises for these, click this video and it'll bring you to one that discusses the 4 that we're talking about and the exercises to resolve them. Hip flexor strain. Now this is highly overdiagnosed, so you gotta be very careful about that. It's most common in sprinters. You'll have pain in the front of the hip. The pain should be reproduced with palpation of the hip flexor, and then stretching or muscle resisting that hip flexor should reproduce your pain. The hip adductors, the muscles on the inside of your hip. The pain should be reproduced with palpation. Stretching or resisting those muscles should reproduce your pain, and the adductor squeeze test should also be positive. Inguinal, the pain location is here. There may be pain with bearing down, and there may be a possible visible hernia. Hip OA or hip arthritis, there's deep hip pain. It's more common in 50-year-olds. The pain and stiffness is worse first thing in the morning and better as you move around. There's reduced hip range of motion, and there's often positive findings on X-ray and MRI. This should have given you everything you wanted to know about hip impingement and more. and give you the tools and education to be successful to manage it all on your own. If you did find it beneficial, please like the video and subscribe to our channel, and don't forget to check out our amazing videos.